Hello everyone, my name is Razia and today I'm going to teach you something very productive that I came across. Looking for this option, yes. So, first of all, I'm looking at one of the CCS cases. So, I'm going to teach about myasthenia gravis. What do we know about this? It's just autoimmune disease. It's because of that excess antibodies that are responsible for weaknesses. So initially, traditionally, we started off with tensilon test. This is not the valid test. Here we used to do it in as conventional terms. So we have several new tests. One of the most important tests is acetylcholine receptor antibodies. Bear with me for this since I'm doing it for the first time. So this antibodies, if positive, it is confirmatory test. It's like positive in almost 80% of the cases. However, if it is not positive, then you can go back to something that I mentioned earlier, that is the tensilon test. While in CCS cases, you do not have to order tensilon test. Okay. This is arbitrary. You may order, you may not order. Now, what are the medications that we use for these patients? Of course, it is pyridostigmine and neostigmine. So pyridostigmine and neostigmine is conventionally used. It is for milder cases, very mild cases. Now, however, if a patient presents to you with weakness, difficulty, breathing, fatigue, and so on, what do you do? Any guesses? You have to do steroids. This is the most important step in CCS. The moment you give steroids, the patient will feel better with, without any trouble breathing. And you have the case on your side. Steroids can be anything like cyclosporin, prednisolone, and azathioprine. Always give this in combination. If you give this alone in CCS cases, especially when a patient presents to you with dyspnea, then you are actually worsening the situation. Please try to give steroids. And then one of the most important other thing to observe in myasthenia patients is to look for something called thymoma. Now, many of them will simply go and order CT scan. You can do so, but then if you do chest x-ray, that will also be correct. Thymoma, for that, the classic the best step for diagnosis is CT scan without contrast. And one of the other important tests, apart from the antibodies, apart from everything else, is EMGs. Please do include EMGs, electromyography study. This is like the neuromuscular junction pathway. This is like the most important to differentiate Lambert-Eaton with that of myasthenia gravis. So, what do you expect? What could be the findings in the EMG? There can be decreased response to repetitive stimulation. Decreased response. Now, anytime a person has weakness, in the muscles, you can do other conventional and standard tests, which include CBC, BMP, aldolase, ENA, CPK, and so on. But these important tests that I mentioned here in this video is the most important. Do not go walk into the exam without knowing these basic stuff. I hope it helps.